Good afternoon, sir. I am Maria Tiadafon and I'm your physical therapist for today. So in today's session, sir, I'd like to ask for your name and your birth date for verification lang first. Okay, that's good. Sige, so sir, the next thing I want to know is, are you aware as to where you are and who you are with right now? Okay, that's good. Sige. So next, sir, what I want to know, sir, is, what did you use upon coming here? Transportation nimo. Gihatod ba ka, sir, o naglakaw ka? Okay. So from the entrance sir going to here, wala ra gyud, short walk ra. Okay, sige, that's good. Di door to door ra ka. Sige, that's good. So next sir, I want to ask, did you take any medications prior to our meeting today? Okay, wala sad. Sige, that's good. So sir, the first thing I will do is I'll be taking your vital signs. So these are my materials for vital signs, and assuming that I've taken patient's vital signs and everything are in normal range, I'll proceed to review of case to patient. So sir, if we are to review your case, sir, summarize na ko imong case. You're a 21-year-old male who is a baseball player who plays the role of as a pitcher. Yeah, you are a right-handed person. Yeah, the thing is, recently you have been drafted to play in the professional field, but you are concerned because recently said you have been feeling an insidious onset pain of fatigue and alternate sensation on your proximal forearm that has caused you different kinds of problems that we will be mentioned later on. So, sige sir. So, first, we will describe unsa imong stage of recovery. So, imong stage of recovery, sir, baguhay ra gyud ka naka-feel of pain. So, we have we have noted na imong stage of recovery is considered as an acute stage. Kay bago pa man gyud siya, sir, it hasn't been more than 7 weeks na, no? It hasn't been more than that. So, muna sa sir. So, now, sir, among diagnosis sa imuhang condition or imuhang case, sir, is that we were able to gather enough data na kuan sa imuhang case na it is a posterior interosseous neuropathy or nerve syndrome. No? That's our diagnosis. Yeah. Next, sir, we have listed you the problem list you have mentioned sa imong case. So, ang among problem list as to why we have come up, no, with the diagnosis, what support is, kuan sad sir, kanay sad siya, mga problem list nimo. 6 out of 10 on the virtual analog pain scale, you've graded it 6 out of 10. So 10 as the worst case, worst pain, and also 0 as no pain. So 6 yeah, present yun si pain. Yeah, next sir, we ask you to describe the kind of pain. You said deep ache in the radial posterior compartment of the forearm. So we ask you to locate it, and we are able to locate it na it's in the radial posterior compartment of the forearm. Next sir, sa imong problems list, sir, you said na onset pain and fatigue only happens during pitching. So when you do your pitching, sir, that's when you feel the pain. Yeah, it is also the next problem listed, sir. The third is it is a pain na progressive siya. So meaning the more pitches you do, the more painful it gets. Yeah, it reached to a point na the only maximum pitches you can do is 35 pitches. That's a problem, no? Yeah, the next sir is there is an altered sensation sa imong dorsum of your thumb, and there's altered sensation sa imong index finger. Yeah, next sir, sa imong case sad, sir, we have noted na there's a problem sa imong wrist and finger because when you do an extension, sir, kana, it is, you feel more weaker and more fatigue, no, na area. Yeah, lastly, sir, upon palpation na mo sa imuhang forearm, sir, we have identified na the muscles na supinator, brachioradialis, and brachialis, there is a presence of tenderness. Sa imong right hand ni tanan, sir, no? Oh, sige. So next, sir, let's mention the functional goal. For the functional goal, ang functional goal with you, sir, it's a mixture of short term and long term. So, among functional goal nimo, sir, is patient will be able to feel relief from the pain in your forearm, no? Yeah, mo na ang first important na ato ang functional goal. Next is patient will be able to do pitching without any pain and is able to go beyond your limits of going beyond 35 pitches. Lastly, next, sir, is patient will have a normal sensation on your fingers, imuhang katong diri, dorsum, sa imong thumb o imong index finger, normal ra imong sensation. There is no alternating sensation na. Next, sir, over time, we want na we over time, sir, we wish or we want na imuhang wrist o imuhang finger extension, when we do extension, sir, ang imuhang responsible muscles there, it will be strengthened. So you can do those na, sir. Yeah, lastly, sir, we don't patient's tenderness in the mentioned muscles. Mawala na siya, wala na to mga tenderness. So that's our answer, functional goal. Next, sir, for the plan of care, among plan of care na gi-create today, sir, it is according to your stage. So since acute stage ka, sir, amo ra yung gi-request nimo, sir, is rest, splinting, amo gi-consider rest, splinting. The arm can be put in the above elbow cast for 10 days with the elbow flex at 90 degrees and imuhang forearm in a supine position and imuhang wrist naka-neutral position. Yeah, if we are talking about therapeutic exercises, sir, we can do this, sir. I want to show it to you. So for therapeutic exercise, sir, we can do passive wrist extension with elbow extended. So this exercise, sir, this therapeutic exercise, sir, you can do this for 5 hold and 5 repetitions. So basically, imo ra ni siya straight imong hand, imong i-bend like this imong hands kani. You will let your other arm pull it backward. No? Ana. So 5 sets of 5 repetitions. No? So it's like that, 5 holds and 5 repetitions di. So i-hold din mo siya 5 seconds, no? So muna. The next exercise, sir, is what you call radial nerve gliding exercise. So for the radial nerve gliding exercise, in-ani, mura ni siya in-ani, sir. But this time, what happened is, ana na siya, neutral position where mong kamot, imura i-rotate imong hand, imong arm, entire arm like this, and after that, iana ni mo imong hand. And you can do, bend your head like this, para mas ma-feel mo ang effectiveness sa therapeutic exercise. So in this, sir, you can do 15 seconds of 3 repetitions for the radial nerve gliding. So next, sir, we can have active range of motion for your wrist, forearm, elbow, and shoulder. So first, how many repetitions is this? Is 2 sets of 10 repetitions need for the active range of motion. So for the wrist, sir, what you can do for the wrist, sir, is if dili nimo kaya ginani, sir, you can do an elbow hook, no? Butangan mo table here. You can bend it like, ana or na ang active range of motion sa wrist. And then sa forearm, sir, i-bend mo yung kamot like this. Yeah, rotate. Ana ra. Yeah, for the shoulder, for the elbow, sir, i-bend mo yung hand going like this. Ana ra. Lastly, sir, for the shoulder, sir, you can bend your arm like this. You can straighten your arm like this. So these are the active range of motions na exercises. So assuming that patient has done these exercises, we will proceed to the getting of the VAPS vital signs. So upon getting patient's vital signs, everything are in normal range. We have done the plan of care, so we will be closing. So sir, thank you so much for coming here today, and I hope to see you next time for our session. So thank you, sir, and have a good day.